Hey, this is Dr. Joe Tanti from Capilano Chiropractic Clinic here in Edmonton, Alberta. Over the past couple of weeks, I've been getting a lot of new patients and existing patients with a lot of low back pain coming in, and a lot of their pain seems to be derived from their discs. So I thought I'd shoot just a quick video kind of illustrating what that means, what the disc is, and possibly give you some tips and things you can do to try to help avoid getting a disc injury in the first place. So essentially what a disc pain presentation may be like, it varies. Some people, they just experience some low back pain. And sometimes this pain is right in the middle, sometimes off to the side just a little bit. Classically, what the history of a person with discogenic pain kind of looks like is they have a bout of pain in their back. It might be from a fall, or it could be a lifting injury. They tried to strain and they lift something up and they felt a pop, or they felt some pain in their lower back. And it goes away in a couple of days. Typically bending forward aggravates it, and going for a walk seems to help a little bit. Laying on their stomach seems to help a little bit. And then time goes on. Sometimes it's weeks, sometimes it's months, sometimes it's a couple of years, and then the pain comes back. It's the same pain that they had before, maybe a little bit worse. And again, it typically goes away after a little bit. And this kind of pattern keeps happening, but each episode that they keep getting it, it seems to be getting worse, getting worse, getting worse, staying longer, maybe not go away quite as fast. And gradually over time, we start to exhibit some other symptoms. Might be getting some tingling, maybe a little bit of numbness, maybe some shooting pain or radiating pain down into the hip, down into the thigh a little bit. And then eventually, if that disc progresses to a full-blown herniation and then it compresses those nerves, that's when we're going to get that sciatica, that radiating leg pain shooting down the back of our thigh, sometimes the front or side, and then sometimes it goes past the knee and into the foot. And that can cause a whole slew of problems. So I'm just going to illustrate what the disc is, just with this model here. So this is just the model from Dynamic Disc Designs. They're great. You should check them out. They have great models. So this is just the lower back. Here's the front. Here's the back here. We have the two bones. Here's 1 and 2. And of course there's more, but this is just this one segment. And we have the disc here in between the two bones. In the back here, these are the spinous processes. These are kind of those bumps you feel as you press along your spine. In the back there, we can see these where the two bones meet. These are the joints, the zygapophyseal joints or the facet joints. And then if we look down vertically here, we can see these yellow things. These are the nerves. They go down the spinal canal near the back, and those nerves, they exit the spine through these foramen here. Now, if we look down vertically at the disc, we can see these outer layers here, this outer layer of the disc. And then in the middle, we have more of this gelatinous fluid type of material, or the nucleus pulposus. And I like to think of the disc kind of like a tire. When we're young, healthy, have healthy discs, that the nucleus is very hydrated and it's kind of pressing out against those other layers. And it keeps the tire or the disc very well balanced and allows us to move around and do wonderful things and live our lives and so forth and move. Now, what can happen over time, and as we age, the disc tends to kind of dry up a little bit. In a young child, that disc is more like a gelatinous type of material, and then as we get older, it turns into more of almost like a crab meat type of material, kind of tough and rubbery. And what that does is it doesn't give the tire or the disc kind of as much pressure against the outside. And this kind of makes it a little more kind of like a tire with less air in it. And that can cause what we call delamination to these outer layers here on that disc, so that inner material can kind of weasel its way through. If we see those red lines there, so that can kind of weasel its way through those different layers there. And that can, one, be quite painful, but two, if it weasels its way all the way out, we see here, see that red line there on the disc, right there. So if it goes all the way out and we get an injury to that disc and it goes all the way out there, it's going to go out into the center. It's hard to see, listen the way. So kind of like that, presses out, and that's going to cause some compression on the nerve. And what that compression is going to do is cause some loss of nerve functions. We're going to get numbness, we're going to get weakness, we're going to get loss of reflexes. And Also, because of that herniation, it's going to cause a buttload of inflammation. That inflammation is going to surround that nerve. It's going to travel down that nerve, and that's what causes the pain, or that sciatic pain that's radiating down into her thigh and into her foot. Wherever that nerve goes, that inflammation travels it. So things that typically aggravate these disc problems are repetitive flexion movements or repetitive bending forward. We typically sit most of the day. A lot of people have sedentary jobs. So trying to make sure that we're kind of counteracting that amount of sitting, amount of bending forward. Also, people that have very physical jobs, mechanics, for example, they're bending over all day over hoods and lifting heavy stuff, heavy tires. People that drive as well, that kind of low-grade vibration in a flex position puts a lot of tension and pressure on that disc. So that can cause a lot of injury here, and that will cause a lot of localized pain. So oftentimes, it's very important to make sure that you, if you do have this kind of injury, get it managed appropriately. If you don't, then it can sometimes progress into that sciatic pain, which is very unpleasant. It's not fun. I've seen a lot of people with it, and it's just not good to have. So if you are having any of these symptoms, please make sure you see and talk to a healthcare provider that's able to help you with these kind of issues, so you can get the care you need. If you have any questions, feel free to reach out. I'd love to help. Hope that helps. Take care.